To truly achieve meaningful use, healthcare organizations really have to have a good understanding of clinical care and their providers. At the end of the day, we have to remember why we are all kind of moving in the direction of healthcare technologies and paperless charting and paperless systems. At the end of the day, we are trying to achieve better clinical care and quality outcomes for patients and families. And what happens is a lot of the time these technologies can actually hamper clinical care instead of enhancing clinical care. And that's why having clinical perspectives early on in the process becomes very important. I'll give you a simple example. As a physician, I use an electronic record when seeing my patients. And one of the newer functions in our system is to actually link lab order entry with patient diagnoses. And essentially this was designed by this technology system in order to essentially force physicians to have an active patient list in the chart at all times. The problem with this is that we actually use labs to help us make a diagnosis. So it's not really intuitive clinically that I would give a patient a diagnosis and then order labs. The way I would normally do it is order labs and then come up with a diagnosis. So you can see how this system would be, somewhat of a barrier in my clinical day. It would be a technology that I wouldn't necessarily want to embrace. And so you can understand how the user wouldn't necessarily be thrilled to adopt this new technology as opposed to paper. So I think it's really important that clinical insights and inputs are really utilized and thought of early on in the process as opposed to after the fact. And at the end of the day, without the clinical perspective and the technology really meshing together, a lot of these investments are really not going to be as fruitful as they could be. So the drivers that should motivate an organization or healthcare system or provider to really adopt healthcare technologies should be based on two things. And one of them should be the high-tech incentives, and the other should be to really improve clinical care, improve outcomes, and really help move their organization forward. So there are many vendors in the marketplace today selling a variety of solutions that are essentially one-size-fits-all solutions. I think it's really important for organizations to take a step back, assess their organization, understand their unique workflows, their unique clinical concerns or challenges that they may have day to day, and then engage with the right consultants and the right vendors. A big part of EHR adoption is understanding your own system and understanding how that system integrates with its environment. An electronic record doesn't operate in isolation. Typically, any hospital system or any big healthcare delivery has a data source and an area that has to engage with lab functions or billing functions or pharmacy functions. And really understanding that enterprise architecture becomes really important before buying a solution or going out into the marketplace and engaging with consultants. So it's really important not to look at this with a narrow focus, which is simply on the government incentives, but to actually understand your organization, understand your organization's unique challenges, and then engage with the private sector and the different solutions out there and offered by vendors to make the right choice for your organization for the long term. This is not about short-term incentives. It's about long-term investments and finding a return on your investment that will pan out into improved quality outcomes, improved clinical measures, and at the end of the day, cost efficiencies. Health IT has the potential to revolutionize the way we practice medicine in this country and beyond. Right now we're at a place in the market where we're running after doctors and running after patients to use these technologies and implement these technologies in their day-to-day clinical interactions. But I think that the doctors of tomorrow are really going to be taking technology and running with it. This is the generation, the doctors that are in their 20s and 30s today are the generation of Facebook, the iPhone, the iPad, of smartphones. These doctors are going to find ways to use the technologies to come up with clinical successes that we can't even imagine. So there's no doubt that right now is an exciting time for everyone in healthcare technology. With the stimulus bill, with the HITECH Act, with all of the meaningful use incentives and criteria that have been set forth by the federal government, I think that organizations that go about this with a very narrow focus and with a strict concern over incentive funding are going to find that a lot of their short-term investments are going to turn into long-term failures. Vangent has a clinical team made of 8 consultants, all of whom are clinicians, all of whom understand both healthcare and technology. At the end of the day, those organizations that use consultants such as ours to really kind of make that bridge between healthcare, clinical practice and technology are really going to be the ones who in 5, 10, 15 years really see the return on their investment. They're going to be proud of the work and proud of the decisions that they made today with the right investments for the future.